thought, oh my God. Like, they don't even have to say it. I know what they're going to say.
Just watch me now. Just watch me. Just watch me.
Hi guys, and welcome back to another episode of Changing Lives on my YouTube channel. I'm Sarah Louise and I'm from SLA Medical. Welcome, Leanne. So let's go through kind of how we met.
Okay.
And then when we cross paths again.
Yeah, so I think it was nearly 8 years ago.
Yeah, we did.
Because I was pregnant with my little boy, wasn't I?
Yes, you were.
So yeah, it'll be around 8 years. I think we've always like stayed in touch. Yeah. And then I was getting ready for my wedding in the Maldives in April.
Yep.
A message was like, Sarah, please can you help me?
Yep, so we're wedding ready.
Yeah, to get wedding ready.
Yep.
Yeah, and then I came in and you treated me beginning of April.
Cool, so let's rewind. I want to share something really unique about you.
Yeah.
How old are you?
34.
34. So 34, but you had a life-changing, so before you came to me and we like had a life-changing event, you had a huge life-changing event.
I did, yeah.
And look, what was it?
I got breast cancer.
Yes.
June 2021.
Okay.
So yeah, had double mastectomy, found out in the June, had a double mastectomy in the August. Then it had spread to my lymph nodes. So I had lymph node clearing in the September.
Yep.
Did 6 months of chemo, started in the October, finished in February this year. And then did a month of radiotherapy every day until the end of March. And then came and saw you.
Holy hell.
I know.
And I will touch on this because this is really relevant to a lot of people. And because you're so young.
Yeah.
And, you know, we think at this age, I'm the same age, and it's also like we're a little bit invincible and we don't think about these things could happen to us.
Not.
And kind of how did that whole experience change you? How did you feel? How was it?
Well, for a start, you're not invincible. It changes you that way. And you can literally be gone like any time.
Yeah.
So I feel like it's changed me for the better in some things. Like I don't worry about things that I used to do, but then it does affect you in other ways. Like I don't have boobs anymore. Like I'm full of scars. I was exhausted when I'd finished treatment. So I didn't look like me. I was just tired.
Yeah.
Yeah. And then afterwards, like now, I've done it all. But now it's harder, like mentally now. Yeah. Like it's really, really difficult actually.
Yeah, and there's like challenge after challenge after challenge, right?
Yeah, every single thing. Like if I get anything, like if I stood up from here and my hip hurt, I'd think, what is that? Like, is it in my hip? Like, yeah.
Absolutely.
It's a lot. But
yeah.
And I think there.
It mentally, you have 2 young children.
Yeah.
Yeah. And how did you feel when it all happened with your children? Because you still had to be a mum.
Yeah, exactly. Well, to be quite honest, I didn't change anything with them. Sorry.
That's all right. Oh, sorry. Get a tissue, it's fine.
No, I'm okay.
All right.
I'm okay. It's only them that makes me sad.
It is. Yeah. Because they are like, when you become a mum, it's ridiculous, right? Nothing else matters. And then you have children and I think I was so tough before I had kids.
Yeah, I know.
I could work with kids, pull chest drains out of children, and then I had children. I was like, I can't do that. I'm going to cry for you.
Yeah. I think for Roman and Arabella, I just thought there's no way that I'm going anywhere. Like they need me. Yeah. There's not a chance my husband will cope without me for a start. Like he doesn't even know where the ironing pile is in my house. Like I don't know what he'd do. But yeah, for them, I just stayed me.
Yeah.
Like it was pretty silly really, the stuff that I did. Like I should have been resting and stuff, but I didn't want them to know anything was wrong.
Yeah.
So like when I had my double mastectomy, that was the beginning of the 6-week holidays.
Okay.
So I had my double mastectomy and then literally did the 6 weeks holidays. Like I think I went to Anglesey 2 days after that. I was on the beach. I was at forest school. They did not have a clue. They just knew that one of Mummy's boobies was poorly, so the doctors was chopping them off. That was literally all I told them. And they never questioned it. Never questioned it. They just said, oh, mummy, can we see your new boobies? So I showed them the scars and they was like, oh, okay. Okay, that was it. Yeah, that was literally it.
I think that's a double-edged sword, right?
Yeah.
You have the energy and the distraction to be able to distract yourself.
Yeah.
So that you can heal and not think about actually the trauma and what's going on.
Definitely.
Versus you're struggling with the energy side of it and that you're not really you at that time.
Yeah.
So I think like that, for me, I would do that. I'd make myself extremely busy so that I don't think about it. If I think I'm a disaster, and I think a lot of mums and girls are.
Yeah, definitely.
And how did that change your perception of body image, your appearance? Because there's so much pressure.
Yeah, so much pressure. I mean, I'd like to think it doesn't bother me, but it does. Like I feel like we're judged on how we look now, which is absolutely insane, but this is just the world we live in now. So for me, some days I think like, oh, it doesn't matter, like who you're trying to impress. And then I put a bikini on and go on holiday and think, oh, I look like Arabella. So it is really hard and I shouldn't really care, but I do.
Yeah, I think it's difficult because the world we live in there's so much pressure about social media and online presence.
Yeah, and this is what I mean with the social media thing. So yeah, I'll post a bikini in my picture and it's easy for me to smile, but really I'm torturing myself mentally thinking, should I post that? Like, what do I look like? Will people, do you know what I mean? It's just not nice.
Yeah,
but,
it's horrible. People are nasty.
yeah, they are.
And that's what we're trying to do is coach and allow people to have more self-confidence and wear your own skin freely and be confident, especially as a woman.
Yeah.
Because that's a huge womanly part of us.
Of course.
And I feel like this would be similar to when we go through a hysterectomy. And we have to go through that part of our life where everything is taken. And it's almost like, oh, my womanlyhood is gone.
Yeah.
And not only do they serve a purpose aesthetically, breasts, but also that is it's you as well.
Yeah, I know.
So, but you're cancer-free.
Yeah, exactly.
Right? So you're healthy.
Healthy.
And actually, who gives a shit?
Yeah,
like,
no.
as long as you're healthy.
Yeah.
And you're happily married.
Yeah.
And 2 children. And so you've got one of each, boy and a girl. You've literally got your whole entire life ahead of you now.
Yeah.
And that's probably the best thing, is that now you can pass on education to others, which you do.
Yeah.
And you can give self-confidence to other women, and you can kind of get past this chapter.
Yeah, 100%.
So I want to touch base on the aesthetic side, because you came to me and we wanted to get wedding ready, which a lot of women do anyway. And they're like, what tweaks can I have before we get married, or, go down that path? It was very quick. So you came to me and you were getting married very quick. So I was like, holy shit, brides scare me already. But then I normally say, let's give you 8 to 12 months as a bride, because I need to understand where we need to get to, what the end goal is, how we rejuvenate you. But how long was it till the wedding?
I think it was like 8 days.
8 days. 8 days I had. It was fabulous. I was like, oh my God, pressure is on. If I've got to nail it once, it's going to be with Leanne. And you presented, and yeah, I think for me, I've not had anyone close to me who's gone through chemotherapy.
Yeah.
And I don't get to see that side of it. I work in it, and I've worked in chemotherapy and cancer before. But having someone that you care about and you relate to is very different. And I think for the first time I seen you, I was a little bit taken back, but I was so proud of you because your confidence. But I also know that that's difficult, because it's a face you need to put on. It's a new environment coming into the clinic. And I remember, and you whipped the wig off and you were like, this thing is itching the crap out of me. And I was like, that is amazing. That is like, you were comfortable. And you know what? Even if you weren't, it was just, that's who you were.
Yeah.
And that was so nice for you to feel comfortable to come into that clinic and into my room where we inject, and you to feel like you could be you.
Yeah.
So I commend you for that, because that was something that really stood out to me, which was really nice.
I remember doing that.
And then I remember taking your before photo.
Yeah.
And the main part that I could see was tiredness.
Yeah, I was
And
tired.
I think that is literally the epicenter of how you felt.
Yeah.
Because of what you've been through.
Yeah.
You said it's exhausting.
I was exhausted. Absolutely exhausted. But you could see that, and I could see that.
Yeah.
And I just thought, no, you're going getting married. You need to lighten up.
Lighten. In actual fact, you're so stunning. And I always thought if anyone could pull off short hair, no hair, it'd be you, because you have the biggest eyes, the biggest cheeks, and the biggest smile. So I always thought if there was one person in this world, you did look glamorous. You did pull that off really well, I must say. But your eyes and they can tell a story.
Yeah.
And you can't hide from your eyes. That's something I noticed with patients. I can really sense their emotional well-being through everyone's eyes. And when they sit on the bed, I can really connect to them and understand them. And I knew that there was trauma, there was tiredness. And that for me was my key goal.
Yeah.
Not for your wedding, but for you as a person.
For me.
And to give you that back. And that was really important to me. And I spoke to you about that. And I didn't want you to sit down and think this is going to be a budget problem. And I thought, you know what? We need to just treat you and get you back to the point where you are confident. To walk down the aisle, to marry the love of your life and the person who support you for so long and is the father of your children, but also for you. Because how I remembered you was when we used to work back at another aesthetics clinic and you were so bubbly. And that smile, I was like, you're literally the life of a room. And I remember talking to my partner going, oh my God, like I explained the whole situation. And it's touching because as a woman, we all fear we're going to end up going through some form of cancer treatment. We have, I believe, a lot more risky areas than men. And it's something that it hit home for me a little bit as well. And I told you, I now check breasts, do everything because of you.
Makes me
I never
happy.
did that before. We did the SLA Refresh.
Yeah, we did.
And we did the dermal filler through the mid phase, through the lower phase, and we just added a little bit of volume.
Yeah.
Right? We didn't go overboard.
No.
We still kept you. How did you feel after that?
Instantly better. It was like I looked better straight away.
Yeah.
And like you say, like with the eyes, I feel like straight away, I just felt brighter.
Yeah.
Yeah, just rejuvenated, a little bit more me again.
Yeah.
Yeah, instantly.
And I think that was the emotional when you got off the bed and you looked and you were like, oh my God, like I get so many women that do that,
Really?
especially women that go through menopause and it's something out of their control. Cancer's out of your control.
Yeah.
We all have to go through menopause and they come in and they're, Sarah, I've aged overnight. Like I don't look like me anymore. Yeah. I still feel like I'm 40. But I am now 50 and I don't feel that age. And there's a stereotypical way, isn't there? Like you're 34.
Yeah.
You still want to be 34.
Of course.
Yet you've gone through a life-changing experience that's made you, your appearance on the outside maybe look a little older.
Yeah.
And that's something I get so often with male and female, to be honest.
Oh, really?
And changes in the eyes and the tiredness. So that for me was really rewarding. And that's my favorite part of the job.
Yeah,
when they get
I
up
can
and there's
imagine.
tears almost coming to their eyes and they're like, oh, I look like me again. And
That's how I felt.
that's it. It's so, that is what keeps me going in aesthetics, I would say, because as a conventional nurse, we typically aren't saving lives, but we are saving lives in a different manner.
Yeah, 100%.
Yeah, it's crazy, isn't it?
Yeah.
Is there any difference? Did you get aesthetics prior for more of an aesthetic overall enhancement? Do you use it now to keep yourself younger? Is there any change in how you viewed aesthetics, or is it the same?
Yeah, for instance, like if I'd go and get my lips done before, it was just to have bigger lips, like we said earlier. But now you didn't even do my lips.
No, I didn't.
Like,
I didn't?
Yeah. So, I do look at it differently now. I look at it to just still look like me, just a bit more refreshed.
Yeah, refresh, there we go.
Yeah.
That's why we named it that, just
Yeah.
to make people feel a bit younger, a bit more youthful, a bit prettier, if that's what they want to look like. As a woman, I think the ideal goal is to always feel beautiful.
Yeah.
And feel beautiful. Not so much look beautiful, but feel beautiful. Yeah. And when we feel beautiful, it's more about looking at ourselves in the mirror. We're so hard on ourselves.
So hard.
And I think like when you, at your age, or our age, you change your appearance that dramatically,
Yeah.
that's difficult. It's difficult and it's out of your control.
Yeah, it is.
That's the most difficult part. And not only did you lose the structure in your face in terms of fat, because you lost a lot of weight.
Yeah, I did. I've put that back on, unfortunately.
You look so, fat is great in the face, I will say.
I did.
Full of face
Yeah.
is a younger face, full of face, younger face. But I think also you lost your hair.
I know.
What was the biggest challenge for you?
Do you know what it was? So my hair, my hair was hard.
Yeah.
My eyelashes was harder.
Oh, yes.
Because I lost all my eyelashes.
Yes, I remember.
I found that so much harder than my hair. It was,
Really?
yeah, because I feel like first, yeah, I was bald and you could probably tell I was poorly. But no, actually, I don't think you could. No, I don't think you could tell I was
Did you wear a
poorly.
hair wrap most of the time?
So I used to wear a wig all the time.
Yeah.
So, and I didn't look poorly, like no one knew. Obviously all my friends and family knew, but if I was out and about, no one would have a clue. But then when I lost my eyelashes, I felt like I looked poorly. I'd think like, oh, they're gonna know, like, not why would I even care? Do you know what I mean? But yeah, for me, it was losing my eyelashes. As stupid as that sounds.
Yeah, but that's so important, right? Because I feel like, I always say when I don't have mascara on, I feel ill.
Yeah.
It's like it gives you the brightness to your eyes, right?
Yeah, it does.
And the color change, you obviously would have felt a bit paler in the skin as well. And I always say when I'm ill, I'm pale and I don't have my mascara on, I can look quite poorly as well.
I looked grey.
Yeah. But
grey, no lashes.
You've recovered so well.
Yeah, I have.
So well. What do you think moving forward will be the challenge now?
Just trying to get my mind better. So I'm working on that. But yeah, and I feel like as long as time goes on, the easier it will get. It will always be there. I know that.
Yeah.
But yeah, just working on my mind really.
Do you get any counselling still? Do you get access to that?
So I pay for a therapist.
Okay.
She's amazing.
Great.
Absolutely amazing. I feel like everyone needs a therapist as well.
Absolutely.
Definitely.
Yeah. So what do you think your biggest challenge is moving forward?
So I've recently started a drug. It's part of my treatment. So I have to take tamoxifen for 10 years.
Okay.
So my cancer was hormonal.
Yep.
So it fed off estrogen. The tamoxifen works as an estrogen blocker.
Yep.
So it'll block the cancer cells out. And then I also have to have an injection I think you can have it once every month or once every 3 months for the next 5 years.
Okay.
Which will suppress my ovaries. So I'll go through menopause in the next 3 months.
Wow.
Which is really scary, actually.
Wow.
I know. So I feel like everyone thinks like, oh, it's done, it's over, she's fine. It's really not. I've got like 10 years of this.
Wow.
Which it's a constant reminder.
Absolutely.
I'm going to change again.
Yeah.
Because I'll go through menopause.
Yeah.
It's just really hard. I feel like, it's a lot.
That is crazy.
I know.
And I don't think a lot of people know that.
No, I don't think they do actually.
Because that's, depending on what drugs you're put onto, would determine what happens in the future.
Yeah.
That is crazy.
I know.
That's scary.
Really scary.
And that I relate to that because of endometriosis.
Yeah.
So a lot of women now are looking at hysterectomies and going through that menopause kind of state.
I know.
Oh my God, it doesn't get easier, does it?
No, it doesn't. I actually feel like it's harder since I finished treatment. It's
okay.
Because you're in sort of a bubble when you're going through it. You're constantly at either the hospital or at Christie's or somewhere. There's always, you see someone every single week, numerous times a week sometimes. So it's a bit like a weird comfort blanket. And then you finish treatment and that is literally it. Like there is people that you can ring when you need to, but
Are you just left on your own?
Yeah, literally. Like I walked out, I rang the bell at radiotherapy and then walked out and got in the car and I just cried because I was like, what do I do now?
Yeah.
It's just like, okay, off you go.
This is crazy.
Yeah, no.
There's no support.
Not really.
Minimal unless you access it.
Yeah, it's minimal. I mean, all my surgeons, my oncologist, everyone has been fantastic.
Yeah.
But they're like, ring anytime and you can, but I don't know.
Well, they didn't teach you.
No.
It's almost like coming out of high school and going into university or into a career and you have no idea what to do.
Yeah.
And no one really pushes you down the right route.
Yeah.
And you feel like you're a burden on people. You don't want to ring them.
Yeah, exactly, because they're like, oh, you're finished now. Like, you're done. Like, well done.
Yeah.
And yeah, I've done that bit.
Yeah.
Like, the cancer is gone. But mentally in your mind, it's not.
Yeah.
Like, everything is scary. And then especially with the with the drugs that you have to take for the next 10 years, I really didn't want to. So I was supposed to start taking them back in February, and I've literally just started like this week.
How come?
So I think at first it was a bit of a control thing. I know it sounds silly because it's sort of to help save your life, but I feel like I had no control over my life for a year and whatever. So it was just like, Leanne, do this, do this, do this. You have to do it or else you'll die. There's no other choice.
Yeah.
So I was so out of control. So then when they were saying like, you have to take this now for 10 years, every single day, it's going to make you go through the menopause, this, that, and the other. And I was just like, no, I'm not taking it.
Yeah.
And my husband would be like, Leanne, why are you not taking it? Why are you not taking it? Please take it. And I'd just say, no, I'm not taking it. And it was control. But then when I started looking into the side effects and things like that, then that is what made my mind up, really. But me and my oncologist, we've came to an agreement now. So I'll stay on this drug for a few months until it's put me through the menopause, and then she'll swap me to another drug that doesn't have as many side effects as this one. And it's slightly better as well.
Do you think you're almost cornered in to a treatment plan?
Yeah. Yeah. And I feel like if I didn't have children, I probably wouldn't do it. I wouldn't.
Yeah, because then you would have no kids.
No, I know.
And then because you're saying if you didn't have kids and you're only thinking about yourself then, right?
Yeah.
And so therefore you wouldn't put yourself at risk.
Yeah. I feel like if God forbid it ever came back, which it won't.
Absolutely.
But if it did, it'd just be one of those things. And I've done every single thing that I could have done. I've done everything they've told me to. I do loads of natural things as well. I've done my best.
Yeah.
Do you know what I mean?
Absolutely. And you're young enough to bounce back. Mm-hmm. And you're at a good age that your body can fight it.
Yeah.
And that's a great thing.
Yeah.
And I think there's a lot more about holistic medicine now, right?
Yeah, a lot.
And did you get caught up in this?
Yeah, so I took like vitamins and herbal things before, but now I literally take a list as long as my arm now. But yeah, I think, and I do think a lot of it works because, so for instance, I'd go for chemotherapy and I'd see other ladies, and I had a really, really hard time with chemotherapy. I was having a reaction to one of them. So every time I had it, I'd end up in A&E.
Oh.
Yeah, it was really bad actually.
Why? What was the reaction?
So it was making my bladder lining rip away. So when I go to A&E as a cancer patient, they don't know what to do because they're not trained in that. So I think I went 3 times and I got sent home and they was like, it's a bladder infection. And I was like, it's not a bladder infection. It's definitely not. And then, yeah, they worked out that it was a very rare side effect and it was making my bladder lining rip away.
And what was the symptoms? What were you getting?
Literally, I actually thought I was dying. So it was bad, actually. It was really bad. So it was like clockwork as well. So I'd have chemo on a Wednesday and then 10 p.m. on the Friday, I'd literally just get excruciating stomach pain. Like Roman and Arabella they weren't at home the first time and then they was in bed the other time. So they didn't see anything. But I was literally curled up in a ball on the floor, screaming for Brett to help me. Brett has never seen me like that. So he just didn't know what to do. We rang an ambulance and they said like, oh, it's a really long wait. Get her there yourself. So we got to A&E and they'd give me morphine, which would stop the pain. But then they didn't know like
how to treat you.
Yeah, they didn't know what was wrong. And yeah.
Oh my God.
I know. And I think that happened 5 times.
Gosh.
5 times. I actually rang my team and I was like, I'm not doing it again. I'm not doing any more. You need to look at what's going on.
Yep.
Because I honestly did think every time I went to hospital, I thought, I'm not going to get out of here because it was that bad. So I'd pass out with the pain, but then the pain would bring me back round. It was so weird. It was, yeah,
this is hard.
crazy.
People don't talk about this.
No, I know. No. And I think because I was doing so I'd be at Castle Howard, I'd be at Blenheim Palace, I'd be in Forest Club, with my children, I'd on Instagram and stuff. But really, I was so poorly, but no one sees the bad bits. We just put on what we want you to see.
That's right. And I think yours was more driven by the fact of the children.
Yeah,
not
100%.
because you were trying to show the world that you were a strong, brave woman. It was more your kids.
Yeah, I didn't want anything to change for them. Like, even now, they still don't know.
Wow. When do you think you'll tell them? Especially Arabella, being your daughter.
Yeah, Arabella. Do you know what? I don't know. I feel like when they're a bit older and they ask me, because they do say to me, Mummy, when we're older, you'll tell us what your poorliness was, won't you?
Oh, wow.
And I was like, yeah, I'll tell you. Because with the chemo, obviously, like, all my hair came out. So I just said, oh, Mummy's a bit poorly. I have to take this nasty medicine and it's going to make my hair fall out. So, and then they was like, so will you tell us when we're older? And so I was like, yeah, I'll tell you when you're older.
It's crazy. Women, I am such an advocate for women, not because I am at all against males.
Yeah.
I have a son and I have an amazing partner, but women, there is this societal pressure that you work, you can't work. So it's if you work almost too much, you can be seen as a bad mum and judged as a bad mother and you're not home enough with your children. You don't work and you're lazy and you're not contributing. You go through an illness and why are you sick? Because you need to be there for your kids. Well, you don't have time to be sick, right?
Yeah, definitely not.
Like,
no time.
Literally. And you're up and you just battle through.
Yeah, you do.
There is this pressure that I feel that doesn't somewhat exist for males on that capacity or at that level.
Yeah.
And I feel for every woman because you're damned if you do and you're damned if you don't.
You really are.
Yeah.
You are.
And I
It's
always
so hard.
say, it's a man's world. I do say this. I say if breast cancer was a male's condition, you know, it would be more looked at.
Yeah.
And I say that with endometriosis, you know, an undiagnosed disease for so long that when, you know, undetected. And it's almost like I get so annoyed that, you know, if we have a bad period, we can't get out of bed, the pain is immense, yet you're expected to go to work. There is no leeway, right?
No, there's none.
Like,
none whatsoever.
You're seeing a little bit more awareness now.
Yeah.
And I feel like we've got better advocates behind us now.
Yeah, definitely.
Which is nice. Are you interested in doing anything or doing something for breast cancer or do you or?
Yeah, I would love to. I mean, I post like every month, like check your boobs. And it's good actually because I know that people do now because I see people and like, Leanne, I've rang my doctors, I felt this in my boob, but luckily like it's nothing. And I just think even if one person checks their boobs now every single month, just for me posting like check your boobs.
That's 12 a year.
Exactly.
That's great.
Exactly.
And I'm one of them.
Yes, that's
I'm
good.
one of them, like literally, like I am one of them now. I do that. And I never
so
did.
good.
And you had breast implants.
Yes. Yeah. So I had breast implants. So when I found the two little lumps, they were quite high up on my chest. I'd probably say like around here.
Which is odd.
Yeah, because I didn't you're supposed to check all the way up to your collarbone, which I didn't realise. I used to check like in my armpit and around my implants, but not all the way up to my collarbone. So yeah, I found like two tiny little lumps. And then when they did I think it was my MRI, I had a 10 centimetre tumour behind my implant, 10 centimetres. Literally, I don't know why I'm laughing. I think I'm just nervous.
This is crazy.
I know. 10
centimetres hiding behind your breast implant.
Yeah.
And I guess we're not saying breast implants are really bad. I have them.
No, I loved them.
But we have to be aware and vigilant for this.
Definitely.
How did you react? Because I've never been in this situation. Did you have a feeling or a woman's gut instinct or intuition when you found the lumps in your chest?
Yeah, I knew straight away.
Did you?
Yeah. Yeah, I knew straight away. Because I'd been previously, I think I'd just had Roman and I had like a little lump under my breast and I'd gone for a scan and the lady was like, this is absolutely fine. It's just your implant. It's like squishy, it moves around. When they're more sinister, they're quite rooted and hard, and that's how they were.
Okay, they didn't move.
Yeah, they didn't move at all. And then I literally rang the doctor the next day, And even he was like, you're young, you're fit, you're healthy, you've never smoked, you don't drink, you don't do drugs. Like, literally,
not
a picture of health.
It increases the risk, but
Yeah.
actually,
Exactly. And he said, I'd be really surprised if it was anything bad. I'll put you on an urgent referral. So he said, you'll hear from someone within 2 weeks. I literally left my doctor's surgery, pulled back up at work, which is like 3 minutes away, and they already rang me. So I was like, oh, this is weird.
Yeah, for not being sinister.
Yeah. So then that was the Friday. I went to the breast clinic on the Monday.
How was that weekend?
Horrific. Like, horrific. I feel like with my whole experience, it's the waiting is the worst bit for anything, because you mentally torture yourself. It's horrible, actually. So I went into the clinic. The lady she gave me a scan.
Were you on your own?
Yeah, because it was COVID.
Oh, shit.
So I did everything on my own. Every single thing was on my own, which it's cruel.
It's so cruel.
Because it's so scary.
Oh, yeah. Now with everything coming out about COVID,
Exactly.
I'm so pissed off with half of this shit.
Yeah, I know.
But for more of the people in your situation and the delayed diagnosis and the people passing away. So you went on your own.
Yeah, I went on my own. They did the scan, and I said like, oh, is it just my implant? And she said, no, darling. And then straight away I thought, it's that. It's that. So they did a biopsy.
Of these ones?
Yeah, because they didn't know about the 10 centimetre one at this point.
Because an ultrasound wouldn't have shown it.
Yeah, no, it didn't. Yeah, it didn't actually.
Because it's the surface of it, right?
Yeah. So then they did a biopsy, and I think I waited almost 2 weeks, which was like 2 years. It was such a long time. But then even then, when I went into the clinic again, I knew it was bad. There was another lady.
Did you go by yourself?
No, Brett was allowed to come with me, which I thought, straight away I thought, that's a bit weird.
Yeah.
And there was another lady with, I don't know if it was her husband or whatever, and a nurse came over to her, and she said like, oh, I'm afraid he'll have to leave. It's only certain appointments that we're letting partners in. And straight away I thought, oh my God, I know what they're going to tell me. And then they called me through, and me and Brett was just sat waiting. And then when the door opened, my consultant walked in, and then behind her was my Macmillan nurse. I didn't know it was her at the time.
Okay.
But I saw the little green pen in her pocket. And straight away, I thought, oh my God. Like, they don't even have to say it. I know what they're going to say. Yeah, then, And then my life changed.
Oh, that's sad.
I know.
That's
it
really
was bad.
crap.
I just remember looking at Brett, and he was white as a sheet, sweating. And I was just like, did she just say that? Did she just say that, Brett? And he was like, Leanne, don't worry, it's fine, it's fine, it's fine. It was horrific, actually.
Oh, God, that is every woman's worst nightmare.
I think I was like, no, it can't be. Like, I've got Roman and Arabella at home. Yeah, and then you just, that all happened. And then I got in the car, cried, pulled myself together and went home and did tea.
Oh, shit.
But we're mums, so that's what we do.
That's it.
That's what we do.
Oh,
and then just soldiered on.
Wow. Yeah, I think that for me is like the fact that, do you know what? The only thing that gets me is children.
Yeah.
And you're like, oh my God, I don't want to miss my daughter's wedding.
Exactly.
Yeah.
Exactly. It's horrible. It is horrible. No, I know. Yeah. Just little things like it's me that reads to them every night. It's me that they shout in the night. Imagine.
Yeah.
It's not nice.
No, that is like my worst nightmare.
And I think I did used to think, like, obviously you have bad days. Sorry.
Don't be silly.
Sorry.
Pass me one. So I guess with our kids, we're always going to be there. We're always the tough ones, the strong ones.
Yeah.
That typical hero mum.
Yeah, 100%.
Hide everything.
Always there.
Always. But I think the biggest thing is now is I always believe the toughest ones are chosen
Yeah.
to voice their opinion and share awareness, which you've done incredibly well.
Oh, thank you.
And I respect you for everything that you've done. I think I look up to you in that because it only takes some of the strongest people to be able to go through that. Not so much just from the illness point of view, but the psychological point of view.
Yeah.
And it's really nice to see that you empower other women. You are a really nice advocate. You always talk about confidence, body.
Yeah.
You're really open.
Yeah, I am open. I feel like that you need to be. Like if somebody asks me something, yeah, I'll tell them.
Yeah. And I think now with you're feeling better and we'll continue on a treatment plan, right?
Yeah, definitely.
Yeah.
I think I'm due in January.
Counting down the days. Yeah. But you don't knock on the door too much.
No.
Some of them I'm turning away. You're very realistic. And what for you in the future do you want to, what's important for you in terms of doing aesthetics and making you feel and your confidence? What is it?
Yeah, so for me, just feeling like myself again, looking nice and fresh, nice bright eyes, gorgeous skin.
Yes. Skin.
Skin.
What do I say? Protect your investment.
Yeah.
If you're going to inject, get some skincare.
Yeah.
And get proper skincare. And we've taken you on a treatment plan.
I absolutely.
You're on a Bagi, aren't you?
Yeah.
Medical grade skin.
Yeah.
And I feel like, you are a very few patients that I have quite a good connection with.
Yeah.
And I'm glad we've gone on this journey together.
too.
Yeah, so it was really nice to have you on though. And I appreciate you
Thank
sharing.
you for having me.
I can assure you everyone will appreciate being more aware, being more educated.
That's what it is, isn't it? It's about-
It is. And also being a confident woman.
Yeah.
Right? And being a boss mum.
Yeah, we do.
Amazing.
No other way.
Amazing. Thank you so much. So guys, thank you for watching. I know it was an emotional one, but it was nice and raw, which we love. Thanks, Leanne, for coming. I really appreciate it. We're going to drop a charity in the description and please make a donation because this goes to all other people and supports breast cancer moving forward.
Just watch me now.